Hi guys, this is Amrit and I would like to welcome you to OsProEd. This video is for educational purposes only and please never practice medical skills without the proper credentials. Today I will show you how to do a counseling case for irregular vaginal bleeding in AMC. Let's say that your next patient is Samantha, who is a 37 years old female, and she's complaining of 12 months of irregular vaginal bleeding. And she is quite troubled with that. She has seen several naturopaths and tried several over-the-counter medications with nil relief. Samantha is hemodynamically stable. Your task is to give counseling on her likely diagnosis and management plan. So here's how I'll start. Hi Samantha, my name is Amrit and I'm one of the doctors who will be looking after you today. I'm so sorry that you're having a difficult time with your bleeding. Look, my task today is to explain more about what it is or what it could be and how we could tackle this issue. Is now a good time for us to talk? Awesome, thank you. Look, from the information I have, Samantha, most likely what you are having is an irregular vaginal bleeding. So the question in your mind would be, what is irregular vaginal bleeding, right? Don't worry, I will explain that to you. Irregular bleeding is any bleeding from a woman's vagina that is not part of a regular menstrual period. Normally, during each monthly cycle, during a menstrual cycle, the lining of the uterus, the womb, gets thicker in preparation for pregnancy. A pregnancy, if it happens, great, but if it doesn't, a period occurs. And when a pregnancy has not taken place, the menstruation happens. So the lining of the womb is shed and blood loss occurs. After each period, the cycle starts again. The amount and duration of bleeding differs from woman to woman and sometimes from month to month. Some women have light periods while others experience heavy bleeding. A period can last from 3 to 10 days and it can occur 3 to 6 weeks. It depends. This pattern can vary with age, stress, diet, exercise, and also inherited factors. The flow can also vary. As a guide, about 2 tablespoons, 40 mils of fluid is lost, which the body quickly replaces. It's also common for women to have cramping with their period. This is felt just below the navel and may spread into the legs or lower back. It can be felt as a dull ache or a sharp twinge. During a period, it's also common to feel bloated and heavy. Some women get more pimples, they feel tense and emotional and have sore breasts. Now look, in your case, what you're having is an irregular bleeding, and the question is, what could be the cause? So there are several causes of irregular bleeding and I will try to explain them. For some women, the cause of bleeding is not found. For others, it could be dependent on their age. It could be sometimes pregnancy. That's the cause. So once pregnancy has been ruled out, there are several known causes. So it could be something to do with the hormones, like being premenopausal or having an ovulation dysfunction. Or it could be changes including stress, such as stress from work or in life in general. Some women can have bleeding due to the contraception in the form of a pill or any other contraceptive that they're taking, like injections or implants, or an intrauterine device. Infections in the vagina or uterus can also cause this. Endometriosis is another condition where the tissues similar to the lining of the womb occur in other places. Trauma can cause this, so damage to the vagina. There's a condition called pelvic inflammatory disease, which can cause abnormal vaginal bleeding. There's a condition called fibroids or polyps, which is a growth of muscle or tissue that can form inside the uterus or the cervix and cause vaginal bleeding. Atrophic vaginitis, in which the lining of the vagina is inflamed due to low levels of hormone estrogen, and usually this is in postmenopausal women. Sometimes medications like anticoagulation, blood thinning medications, or anti-epileptic drugs can also cause bleeding. Sometimes underlying health problems like bleeding disorders or thyroid problems can sometimes be the culprit. Cancer in the lining of the uterus, cervix, or vagina is rare, but it can also cause abnormal vaginal bleeding. The cause of bleeding may be obvious from your medical history, but sometimes tests may be needed to find a diagnosis. These include like a pregnancy test, a physical vaginal exam to see where the bleeding is actually coming from, a cervical screening test like a pap smear or HPV screening, and swabs for infection. We can order an ultrasound and see if there's any structural abnormalities, and you may need to undergo a biopsy to investigate further. Additional tests like thyroid function tests, and also checking your iron levels just to make sure you're not running too low, and additional hormone tests can be done to investigate. When it comes to treatment, the possible treatment of vaginal bleeding depends on the cause of the bleeding, and it can include either change of contraception, including changing your oral contraceptive pill, anti-inflammatory medications such as ibuprofen, mefenamic acid, or some similar drugs, antibiotics if an infection is found, hormone therapy or anti-bleeding drugs, surgery, treating any underlying health problems. You may be referred to a specialist doctor like a gynecologist for further treatment, depending on the cause that we find or if bleeding persists. There's a few things that you can do, Samantha, in home care. There's a few things such as maintaining a diary of your symptoms to show us next time, also for your own record. If your bleeding is painful, then there's a few techniques that may help, like placing a warm pack such as hot water bottle wrapped in towel or a wheat bag on your abdomen. You can take a warm bath, rub or massage where it hurts. You can take pain medications such as paracetamol or anti-inflammatories, things like ibuprofen. If pain is severe, please avoid aspirin. Just stick to the Panadol and ibuprofen. Try some simple relaxation techniques. You can also consider magnesium or vitamin B1. So Samantha, until I get your results back and follow up, it's important that you are aware of red flags and you are able to escalate for care. If you are starting to become short of breath, dizzy, experiencing chest pains, if you're passing more than a pad of blood every 2 hours, you should seek urgent medical assistance. So that's irregular vaginal bleeding counseling, guys. I hope it was helpful. Don't forget to hit the like and subscribe if you have not already done that. Until next time, ciao.